We are dealing regarding the topic HIV/AIDS. We have already dealt the definition, the mode of transmission, pathophysiology, clinical manifestations. Now I will be dealing regarding the management. So particularly first I will take the pharmacological management, that is the drug therapy for HIV infection. So this topic is also very important. So now particularly we are already knowing that HIV AIDS is not curable, isn't it? Now what is the goal? So that we have to take the drugs. Okay. So even though it is not curable, the HIV treatment has to be taken by the patient. The reason here is, the main thing is, the HIV drugs will reduce the viral load. Okay, and next is it will help to maintain the CD4 count, that is the T helper cell count can be usually maintained by taking the drugs. Next is it will also delay the development of HIV related symptoms, and it will also delay the opportunistic diseases that is caused because of HIV infection. We have already seen this opportunistic diseases like your candidiasis, then it has also resulted in scabies, psoriasis and other skin infections, herpes, syphilis, tuberculosis, influenza, pneumonia. Okay, all these are the opportunistic diseases. So that also will usually reduce if you continuously take the HIV treatment. Now there are some guidelines for the HIV treatment. Okay, so these are the particular principles of HIV treatment. So first and foremost, it depends on the risk of the disease progression. Okay, the HIV treatment that is given, that is the tablets which are given, it depends on the risk of the disease progression. How you will know regarding the progression of HIV/AIDS? It is usually known by the amount of viruses that is present in the blood, or if there is high viral load, it means that the patient has to take the HIV treatment. Or if at all the patient is having very low CD4 counts or T helper cell count is there, in that case also it means that the disease is progressing and the patient has to go for HIV treatment. Next is combination of antiretroviral treatment suppresses the HIV replication. It is also told that if a patient is given combination of drugs, usually three drugs will be given in combination. Okay, three antiviral, ARV means antiviral. Okay, so three antiviral drugs are usually given in combination in the case of treatment of this HIV/AIDS. Okay, ART means antiretroviral therapy. Then the next principle is women should receive correct or optimal antiretroviral therapy regardless of pregnancy status. Okay, regardless of whether they are pregnant or not, the woman has to be given the antiretroviral therapy. Next is HIV infected persons, even with low viral load, if they are having very low viral loads also, or those who feel that they are effective for this antiretroviral therapy, if they feel that treatment is effective, in spite of that they will be considered as infectious. Okay, so always you must be knowing that an HIV infected person will have the infection lifelong, even though they have taken the treatment, or even if they are not having the symptoms, it does not mean that they will not spread infection. Okay, they will be having the virus lifelong in their body, so that is why they can spread infection, and they must follow the correct safe practices to avoid spreading of the infection to other patients. Next is of no drug or drugs or combination of drugs will cure HIV. This point already I have stressed earlier. Okay, so till now there is no treatment for HIV/AIDS, but only thing why this antiretroviral therapy is given, because it will reduce the viral load, that is it will decrease the viral replication, it will delay the progression of the disease, that is it will delay the clinical manifestations. Okay, so that is why we have to take the treatment of HIV AIDS. Now, particularly, I discussed what is the necessity for this ART. Now, we will see what are the drugs that is given in this ART, that is antiretroviral therapy or treatment. So, we have got 5 groups. Some books will given 4 also classification. Some may give 6 also. Okay. First combination is nucleoside reverse transcriptase inhibitors. Some books are giving this first one and fifth one together. Okay. So first one is nucleoside reverse transcriptase inhibitors. Next is non-nucleoside reverse transcriptase inhibitors. Next classification is protease inhibitors. Then entry inhibitors, nucleotide reverse transcriptase inhibitors. Okay, so treatment is usually given when the CD4 count usually reduces 200 cells per ml of blood. Okay, so when the CD4 count has reduced to less than 200 cells, usually they will start with the treatment. So first one is nucleoside reverse transcriptase inhibitors. So in case of this nucleoside reverse transcriptase inhibitors, the common drug that is given is zidovudin. Next one is lamivudin, then stavudin. Zidovudin is actually the first choice of drug. Okay, it is the main antiviral that is given. Usually 500 to 600 mg orally will be given daily. Lamivudin 150 mg orally BD. Stavudin is given 40 mg orally BD. Okay. So what is the action of this 3 drugs, that is nucleoside reverse transcriptase inhibitors? By the name only it is there, it is inhibiting the reverse transcriptase enzyme. Okay. So what it does, it inserts a piece of DNA into the developing HIV DNA chain, thereby blocking the development of the chain. It will block the development of this DNA chain and it will prevent the complete formation of the HIV DNA. Okay, so finally what happens, because of this incomplete HIV DNA, it will prevent the viral replication. Okay, so just remember that nucleoside reverse transcriptase inhibitors are those drugs which will prevent the replication of the virus. Now next one is non-nucleoside reverse transcriptase inhibitors. So these drugs are usually given in combination with the first drug, that is nucleoside reverse transcriptase inhibitors. Okay, and these two combination of drugs are usually given. The example of NNRTIs are nevirapine, then atazanavir, darunavir, then ritonavir. Okay, then one more drug is there, fosamprenavir. Okay, so these are the drugs that is given here. And commonly when we are giving this nevirapine drug, it will be given 200 mg orally and daily it is given for around 2 weeks. And after this 2 weeks, what they will do is they will give 20 mg. They will reduce the dosage to 20 mg orally. BD they will be giving. Okay. And the action of this non-nucleoside reverse transcriptase inhibitors is, here also it will reduce the viral replication. It will combine with reverse transcriptase enzyme to block the HIV RNA into HIV DNA. This we have already dealt in pathophysiology, isn't it? This HIV virus is actually a retrovirus which is multiplying in a backward manner, that is from RNA to the DNA. Okay, so this drugs will prevent the conversion of HIV RNA to HIV DNA, thereby it will reduce the viral replication. Now most of these HIV drugs are having lot of side effects or adverse effects. Okay, so adverse effects like rashes are seen, increased liver enzymes. So that is why whenever the patient is taking HIV drugs, you should always monitor the liver enzymes like SGOT, SGPT or serum bilirubin levels. Okay, and sometimes it is told to result in liver damage or hepatotoxicity. So always monitor the liver function test. Okay, and most of the time it is told that this HIV drugs can cause GI upset. They will usually complain of abdominal pain or abdominal cramps or sometimes diarrhea, Then headache is also one of the major side effects. Next drug is nucleotide reverse transcriptase inhibitor. Example is TDF. Okay, full form is tenofovir disoproxil fumarate. Okay, the action of this drug is it will prevent the it will inhibit the action of the enzyme reverse transcriptase, thereby it will inhibit the viral replication. Same side effects are there of this NTRTIs, nausea, vomiting and diarrhea. Next classification is protease inhibitors. In protease inhibitors, commonly we give the drug injinavir as well as nelfinavir and saquinavir. Okay, so saquinavir when it is given, it is 600 mg orally 3 times a day. Injinavir we are giving 800 mg orally 3 times a day. Nelfinavir we give 750 mg orally twice a day. So what is protease inhibitors do is they will prevent the enzyme or it will inhibit the protease enzyme from cutting the HIV proteins into proper lengths. So thereby you can tell that this also will prohibit the viral replication. Then adverse effects of protease inhibitors almost the same thing, nausea, vomiting, diarrhea, headache. Then sometimes it can cause hyperglycemia. Hyperglycemia means there is increase in blood sugar levels. Hyperlipidemia means there can be increase in the lipid levels or increase in cholesterol levels in the blood. And then lipodystrophy, that is destruction of this muscle cells usually. Okay, and certain cases it will increase the bilirubin levels, that is referred as hyperbilirubinemia, and then that can result in jaundice sometimes. Next is nephritis. Most of the time it can cause inflammation of the nephrons. Then kidney stones can also be one of the major side effects of protease inhibitors. Next one is entry inhibitors. In case of entry inhibitors, these will prevent the binding of HIV to cells, thus it will prevent the entry of HIV into the cell. Okay, so this also will prevent the viral replication, and most of the time these entry inhibitors they may result in side effects like rashes. Okay, so in the site of the injection it may result in some reaction. Fatigue can be there, nausea, vomiting, diarrhea, insomnia, that is lack of sleep. Then hypersensitivity reaction in the region where injection is given. Sometimes it can cause a respiratory condition referred as pneumonia. Then peripheral neuropathy, where the patient will be usually having tingling sensation, numbness or weakness in the arms as well as in the feet. Then next one is combination therapy, where they will be giving a combination of different drugs like tenofovir, then emtricitabine, then efavirenz. It is together referred as atripla. Then next is certain other drugs. Now certain other drugs are given to treat the clinical manifestations that is caused by this HIV AIDS. Like the patient can develop some opportunistic infections. So in that case we can give Bactrim, okay, or you can also start with the antibiotics. Then for diarrhea, we can give antidiarrheals. Then we have seen that the patient is having Kaposi's sarcoma. For that, we can give chemotherapy for the patient. Then most of the time, it is seen that patient with HIV, they can have depression. Okay, so to treat that, you can give antidepressants for the patient. Then next is the most important part, that is nutritional therapy, because we are already knowing that one of the complications we can tell of HIV AIDS is weight loss or cachexia we call it. Completely the patient becomes emaciated. So a good diet is very essential. If patient is not feeding orally, you may have to start NG feed or maybe parenteral nutrition. Then you can give appetite stimulants for the patient so that they will not have anorexia, because most of the time when the patient is taking the treatment, they will complain of nausea, vomiting or anorexia. Okay, so you can give this appetite stimulants. Then other than that, you can start with high calorie diet, high protein diet, okay, and low fat diet. See that the diet is easily digestible and palatable for the patient. Next is role of a nurse in this antiretroviral therapy center. Okay, in the ART center, what is the role of a nurse? So first and foremost, the nurse has to assist the clinical, clinical and paramedical people to function well. Next is the nurse has to see the baseline assessment of the patient. For example, they have to monitor the height, weight, vital signs, BP, pulse. Okay, then at the same time, you should see that the patient is taking the medicines on time, and then also she has to monitor the side effects of these medications. Next is assess the physical, social and psychological needs of the patient. We have already seen that a patient with HIV AIDS will overall have effects on the physical as well as psychological. Okay, so you can give psychological support to the patient also. Okay, and they will also have problem with social stigma because they are suffering with HIV AIDS. So it is good that the nurse will help them to mix with other people who are having HIV AIDS, or how they are progressing in their life, or how they are carrying out their occupation and all. Next is the nurse has to provide the nursing care and support to the patient. Next is the nurse has to focus on the pregnant positive women and HIV exposed children as well as the infants. Okay, in case if there is no counselor. Next is she has to maintain a daily summary sheet. Now this is important because why she has to maintain this daily summary sheet is to know the adequate survey, how many HIV patients are there, how much treatment they are taking, whether they are coming regularly for follow-up. All this data report has to be submitted to the data manager. Next is coordinating and tracking the referrals. That also has to be done by the nurse. Next is she has to guide the patients in the ART center. She has to adequately maintain the records and the documents of the patient. She has to dispense the ART drugs, especially if the pharmacist is not available. Next is role of a nurse in counseling. So we have got pre-test counseling, means before the counseling, what is the role of the nurse? So before the counseling, the nurse has to assure confidentiality. She should see that privacy is maintained. You can ask why they have come for HIV testing, and you should take informed consent from the patient. Okay, and then what you have to do is prepare them for the result. So in the post-test counseling, if the patient has become positive, it is very essential to guide or to recruit to a counselor. Okay, and test results should be given immediately, should not delay the test results. And next is if the patient is experiencing any negative result, or if the person is negative in the window period, you can ask the patient to come again for a diagnostic procedure. Then tell the patient to concentrate on their nutrition or diet, then tell them to maintain a good hygiene, and also teach them regarding safe sexual practices, and also assess the emotional issues of the patient. That is very essential. Okay, the nurse has to follow the principles of counseling, that is maintaining confidentiality, you have to be trustworthy, then maintain the freedom or autonomy of the person, that is independence of the person, then see that you're following the principle of justice, and follow self-respect for the patient. Next is refer the patients to suitable places like sexually transmitted diseases clinic, or PPTC and ICTC. Okay, PPTCT means prevention of parent to child transmission. So in this center, it will mainly guides the or prevents the transmission of HIV/AIDS to the child from the parents. Okay, so your proper diagnosis also will be done, and proper treatment of the parent is also done. Usually they will monitor if the child is getting the infection from the patient, and it prevents the transmission of the infection also. And next is ICTCT, that is Integrated Counseling and Testing Center. So in this Integrated Counseling and Testing Center also what they will do is they will diagnose for HIV AIDS, okay, by maintaining privacy and confidentiality, and then they will give adequate counseling for the patient. Next, it is very essential to educate the patient and the family regarding the mode of transmission of HIV AIDS. And also you have to explain which are the different methods through which HIV AIDS is not transmitted. That is very important. Otherwise, what happens is the family will try to ignore the patient and they may have a stigma. Okay. Help the patient to deal with grief and loss. That is also a very important aspect, so that the person will not go into depression or will not commit any suicide. Okay, so this is particularly about the drug management and certain role of the nurse in counseling. Next, we will see the prevention of HIV AIDS.